Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about 10 warning signs of high blood sugar. What does high blood sugar mean? High blood sugar, also called hyperglycemia, is when the bloodstream has too much glucose. People with diabetes worry about this more often than people who don't have diabetes. Our bodies are usually pretty good at keeping our blood sugar in the right place. But sometimes, like when a person has diabetes, they can have too much sugar in their blood. Blood sugar, which is also called blood glucose, is measured in milligrams per deciliter, milligram per deciliter. According to the Cleveland Clinic, a fasting blood sugar of more than 125 milligrams per deciliter is a sign of hyperglycemia. The Cleveland Clinic says that a person may also have hyperglycemia if their blood glucose level is over 180 milligrams per deciliter 1 to 2 hours after they eat. Healthy blood sugar. When glucose from the food we eat gets into the bloodstream, the pancreas normally releases just the right amount of insulin. Insulin is the hormone your body needs to move glucose from the bloodstream into the cells, where it can be used for energy or stored. This keeps the amount of glucose in the blood within a pretty narrow range. Person who doesn't have trouble controlling their blood sugar shouldn't ever get too hyperglycemic. Low blood sugar. According to the National Institutes of Health, hypoglycemia, or low blood sugar, happens when your blood sugar level drops below normal, NIH. The Mayo Clinic says that low blood sugar is usually shown by a fasting blood sugar level of 70 milligrams per deciliter or less. Causes of high blood sugar. You might think that hyperglycemia can be caused by eating a very sweet food, but it's not that easy. Blood sugar can go up if you eat a lot of sugar or carbs, but that's usually when your pancreas kicks in and starts making insulin to move glucose into cells all over the body. But when a person has diabetes, this well-balanced system is thrown off. The NIDDK says that people with type 2 diabetes can't make enough insulin or can't use insulin well. The CDC says that 90% to 95% of adults with diabetes have type 2. The NIDDK says that if someone has prediabetes, their blood glucose is higher than normal but not quite in the range of type 2 diabetes yet. And in type 1 diabetes, the body either doesn't make insulin at all or only makes a very small amount. In any case, you end up with too much sugar in your blood, which makes you feel terrible in the short term and puts your health at risk in the long term. Signs of high blood sugar. If you have diabetes, you already know what it feels like to have hyperglycemia. If you have diabetes, you can also check your blood sugar regularly to keep track of it. But for the millions of people who have diabetes or prediabetes but don't know it, knowing the signs of high blood sugar could make them go to the doctor right away and get a diagnosis. The symptoms of type 1 diabetes can come on quickly and be very bad, but the symptoms of type 2 diabetes can come on slowly and be so mild that you don't even notice them, says the NIDDK. The NIDDK says that most people with prediabetes don't even know they have it. So, the NIDDK says, it's very important to get checked out if you have risk factors like a family history, being overweight, or being older than 45. Still, there are many possible short-term and long-term signs of high blood sugar that you should be aware of, especially if you are at a high risk. Early symptoms of hyperglycemia can include 1. Feeling tired. Feeling tired may be the most common early sign of high blood sugar. She says it can also happen to a small degree when people without diabetes, or with prediabetes, eat a lot of simple carbs like sugar and their blood sugar goes up and down in a normal way. 2. Frequent urination. When you have too much sugar in your blood, your kidneys try to get rid of it by making you urinate more often. When they get rid of the sugar, they also get rid of water, says Dr. Hatipolu. You have to go to the bathroom more often because of this. 3. Increased thirst. This is a natural side effect of having to go to the bathroom more often because your body loses water. Dr. Hatipolu says that people start to feel thirsty all the time. The Mayo Clinic says that dehydration becomes a cycle. The more you pee, the more thirsty you get, and the more you drink, the more you pee. 4. Headaches. Headaches can be caused by any reason that makes you lose water. Headaches can be caused by a lot of different things, but it's best to see a doctor if they're new or come with other symptoms. Being dehydrated can also make you feel more tired and give you headaches. 5. Blurred vision. The Cleveland Clinic says that too much sugar in the blood can affect parts of the body you might not expect, like your eyes. Extra sugar and a little bit of water get stuck in the lens in the middle of the eye, making it hard to see. This is short-term and not the same as the long-term damage to the eye that can happen with diseases like diabetes. 6. Nausea, vomiting, confusion, and more. The U.S. National Library of Medicine says that nausea, vomiting, confusion, and other seemingly unrelated symptoms are all signs of a rare and life-threatening condition called diabetic ketoacidosis, DKA. DKA can also cause stomach pain, trouble breathing, dry or flushed skin, breath that smells like fruit, and trouble paying attention. According to the U.S. National Library of Medicine, it usually happens to people with type 1 diabetes and is sometimes the first sign that they are sick. DKA can happen less often and in a milder form in people with type 2 diabetes. The U.S. National Library of Medicine says that DKA happens when the liver can't use the sugar in the blood for energy because it doesn't have enough insulin. Instead, it starts to break down body fat into a type of fuel called ketones at such a fast rate that the ketones become toxic and make the blood acidic. If DKA isn't treated, it can be fatal, so anyone with these symptoms should get help right away. Over time, if high blood sugar is not treated, it can cause more symptoms, such as 7. Frequent infections. According to the CDC, hyperglycemia can weaken the immune system and make it harder for the body to fight off infections. This makes it harder for your body to fight off some infections, so they come back more often, stick around longer, or get worse. The NIDDK says this is because the extra sugar in the urine from high blood sugar feeds the bacteria that can cause these infections. The CDC says that diabetes can also make you more likely to get UTIs. 8. Slow healing sores. High blood sugar levels can also affect your circulatory system, making it harder for blood to flow and the body to heal itself. The Mayo Clinic says that a common sign of this is sores that take a long time to heal, most often on the feet. 9. Dental issues. Glucose is in both your blood and your saliva. The National Institute of Dental and Craniofacial Research, NIDDK, says that when there is too much of it in your mouth, it helps bad bacteria grow and mixes with food particles to make plaque. This can lead to problems like bad breath, tooth decay, cavities, gingivitis, and gum disease. One of the first things to look out for is gums that are swollen, sore, and bleed. 10. Tingling in the hands and feet. Over time, hyperglycemia can start to affect how nerves work and can lead to nerve damage, which is called neuropathy. The NIDDK says that peripheral neuropathy, which affects the hands and feet, is the most common type. The Mayo Clinic says that you might start to feel tingling, numbness, or burning in your hands, feet, arms, and legs. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.